Hi, thank you for joining me on this lovely Tuesday evening. I hope you've had a wonderful day, and I'm very excited to get to some of the questions that you all have been asking me tonight. That is what tonight is about. So for the next 20 minutes or so, I'm going to answer as many questions as I can regarding your hand arthritis. First, a few housekeeping things. Tomorrow is your last day to enroll in Healthy Hands Academy. I'm not going to reopen this again for another 3 months or so that I can provide as much support that I need to my current students who have enrolled. It's for you if you want to transform the way that you support, protect, and exercise your arthritic hands, not only now, but for the rest of your life. So, first question. Heat or cold? If you have hand pain or just any pain in your body, you've probably been told a lot of conflicting things about ice versus heat. So, ice tightens and contracts our muscles, whereas heat can relax our muscles. Ice decreases your blood flow and heat increases your circulation, which can then actually help the good things to get into your cells and promote better tissue healing. Ice is generally recommended for acute injuries, although there has been some new research that has kind of contradicted this as well. And then heat is best for chronic conditions and chronic pain typically. Ice can actually stiffen your joints, and because it stiffens your joints, this might lead to a decreased range of motion. And as you might guess, heat does the opposite. Heat can loosen your joints, not only your muscles, but also your joints. And this also may help to increase your range of motion, which is why oftentimes with people with chronic hand conditions, I usually recommend heat if it feels good to them before exercise, because then they can get the most out of their exercises. Ice is often prescribed following rigorous exercises like in physical therapy, whereas heat, like I said, is pretty typical to give before any sort of exercise or like range of motion exercise, just to maximize how much motion your joints are actually getting. And then ice also temporarily reduces nerve activity around the area that it's applied to, which actually numbs it, which you've absolutely experienced before. So while it might sound that I'm like anti-ice if you have hand arthritis, if ice helps, use ice. If heat helps, then use heat. If you like a combination or haven't considered a combination, maybe you can try a combination of ice and heat. Maybe 5 minutes of heat followed by a few minutes of ice. That can actually help to open and close your blood vessels rapidly, which can create a pump to actually help to move fluid out of the area that has inflammation in it. Also, just as a side note, if you have rheumatoid arthritis and you're in a pretty big flare, then heat is generally discouraged because it does ramp up your circulation, then that can lead to increased inflammation and prolong your pain flare. There's also some emerging evidence about infrared heat, which I personally haven't tried, but it is on my list of things that I would love to try. Infrared heat is great because it penetrates 10 times deeper than regular heat. So it penetrates about 2.36 inches, which is obviously way deeper than like a surface level heat. Infrared heat also doesn't burn or dehydrate your skin. It targets pain and inflammation where it originates because it can penetrate so deeply. And I've seen a lot of good reviews of the Thermotex brand, although again, I've never tried that, so I can't personally recommend it. All right, second question. I have played piano my whole life, and I also just graduated from dental hygiene school. My right thumb hurts all the time, and I don't have a tight grip anymore. How can I relax it? Okay, I'm so sorry that you're experiencing this, and this is actually like pretty common in people who use their hands for a lot of tight holding and gripping onto small things, such as dental hygiene work. I've actually treated quite a few dentists and dental hygienists in my time as a hand OT because it can wreak havoc on your hands. And oftentimes when you're just starting out, like it is like a shock to your hands and to your system. So It might be arthritis, it might be a repetitive strain injury or tendonitis, I'm not really sure. I would definitely recommend that you talk to a doctor about it to make sure you have a good handle on the situation. But either way, we can approach this just through targeting like what is going on. So your right thumb is hurting all the time. Finding multiple good hand and wrist supports is going to be key, because those joints and the muscles surrounding those joints and those tendons need to find rest, as you said, in order to decrease inflammation. So the best way for those to find rest is to settle into a good hand support or even multiple good hand supports. I'm guessing you would not be able to wear some big, bulky hand, wrist, thumb brace as a dental hygienist. You have to find a hand support that's able to fit underneath your medical gloves. So you're going to need to look for multiple options. At home, you might look to more of like a traditional immobilizing brace that you might put on after a long day of work when your hand is really flared and it just needs to like be still and rest, and you're watching Netflix or something or even sleeping. That's when you could use like a bigger brace. But for work, you can still find some great low profile options that can honestly fit like right underneath your medical gloves. I actually do that quite a bit when I have hand pain. So I like kinesio tape on my thumb. And this is the brand that I use, not just because it comes in hot pink, because I'm pretty sure like all of the brands come in lots of different colors. I like this. It's a big roll, and it's 2 inches, and it's a roll. It's not like those pre-cut strips. So I really like a 2-inch roll of kinesio tape because I can get really creative with the application and like make it do what I want it to. Whereas with the pre-cut 2-inch strips, you're kind of limited in terms of like the length of it. So kinesio tape, the push meta grip is also just like a wonderful low profile support option for your thumb that can fit right underneath your glove. And it's rigid, so it actually does like hold, like supports your CMC joint down here, but you still have quite a bit of thumb range of motion. It just provides some nice support, but you still have mobility. And again, my medical glove fits right over top of that. I also wanted to show you these silicone thumb supports as a great low profile option. They're kind of tricky to get on without like coating them in baby powder, so I won't coat them in baby powder, but basically they just slip right on over your thumb and your wrist, and it acts to like provide some compression, like targeted compression at the joints that are hurting, and then it can provide some good support and some pain relief. So this would absolutely fit also underneath a medical glove. So the next question I got: once ulnar drift / deviation occurs, is surgery the only option to reel it in? I love this question. So ulnar drift deformity is actually the most common hand deformity in individuals with rheumatoid arthritis. And ulnar drift deformity looks something like this. So it's when our fingers drift in this direction towards the pinky on their own, and you can only like passively get them back up here, so you can't really actively like get them back up straight. They kind of tend to rest here. It happens, you know, I think there are a lot of different reasons why it happens, or a lot of different contributing factors. Oftentimes rheumatoid arthritis is accompanied by a whole lot of swelling and synovitis in these large knuckles, and then when that happens, the tendons that are supposed to go right over top of the knuckles actually like slip off of the knuckles, and then it causes like a subluxation here, and so when the tendon is slipped off, then you can't really actively extend your fingers, and all of the things that we do with our hands every day actually put like a downward pressure on our hands in this direction anyway. And so when you have like a, I guess, off balance tendon mechanics and joint mechanics here, then all of the forces of gravity, like let's say I'm picking up a big heavy coffee pot with my hands, that's putting the gravity's putting pressure in this downward motion on my fingers. And so that is, I guess, sort of like how ulnar drift deformity usually begins. And so when it comes to thinking about options for treating ulnar drift deformity, surgery is probably like the only thing that could like completely reverse it. Like there's no conservative option that I'm aware of that would get your joints into like literally alignment and stay there without any sort of like splint or anything. But it is really important to fully understand what each surgical option entails before you pursue it. So one of the most common surgeries to reverse the effects of ulnar drift deformity is called a metacarpophalangeal or MCP arthroplasty. So that big word, the MCP word, is just talking about these joints right here. And an arthroplasty is just replacing those joints with artificial joints. And so it says, that this surgical method can help to improve pain, alignment, and function in people with ulnar drift. And again, it replaces these joints with artificial joints. Some other surgeries include a synovectomy, which is actually the removal of a layer of connective tissue that surrounds your joint. And that would be like when the inflammation is so significant that is, I guess, like the best surgical option there. A tenosynovectomy, which is the removal of the membrane or connective tissue which surrounds the tendons that are in this area. Another one is like a tendon realignment, and then another common one is an arthrodesis, which is actually a joint fusion. Now, an arthrodesis or a joint fusion is probably like the most significant surgery that you could ever think of for this, because when you get a joint fusion, that literally means that your joint won't move anymore. So that would mean if whatever joint you're getting fused, like it would be stuck. Like your joint would not move. It would just be stuck in that position. Not like your surrounding joints could move, but whatever joint you're getting fused would be stuck there. And often, I can't tell you how many times clients have signed up for a fusion like down here, and they didn't really realize like what they were getting into. So as therapies progressed, they don't understand why they can't really like rotate their thumb this way. Like they can only move their thumb like this, but their thumb is sort of stuck here. Like they can't flatten it out. They can't like rotate it fully. And it's like, yeah, like that's a joint fusion. And I wish that surgeons would just really, I guess, explain it better or in a way that patients would understand before you sign up for it. So everything that I've read says that for ulnar drift deformity, surgical treatment tends to have more success in improving function if it's done early in the course of the deformity. That being said, surgery comes with its own drawbacks. Even with surgery, it's hard for your hand to return to a normal hand or what you remember as your hand is before you got ulnar drift deformity. You'll likely still experience the stiffness and soreness, which is accompanied by rheumatoid arthritis if you get the surgery, and especially if you get the surgery but you don't make other changes. However, you can halt the progression of ulnar drift and avoid a real need for surgery by doing a few things. So you can wear an anti-ulnar drift splint during the day. And this kind of splint is usually it usually just comes down to about here or so. So it's not like some huge thing. And what it does is it has like little counter forces on this side of your finger to counteract that motion. So basically the splint would come here and just move. If your fingers are this way, it would move your fingers back into better alignment, but you would still be able to use your hand. It would just improve that joint alignment, which could, improve your function not only, but also decrease your pain a lot. I usually also typically recommend wearing a larger night splint to improve your joint alignment there. And so a night splint for someone with ulnar drift deformity might actually come down here and support the wrist, possibly even support the thumb, and then also come up here to support the fingers, and again just like gently sort of position them in like a more of a lined position. Some other things that you can do if you have ulnar drift deformity and you're trying to avoid surgery would be practicing joint protection. So these joint protection techniques, like the hacks that I often share about or the gadgets that I usually show you, they can actually counter the effects of gravity on your hand to decrease that ulnar drift deformity. So like I said, like if you're imagining picking up like a heavy coffee pot with one hand, holding that handle literally puts like a downward pressure on your fingers. So even just like getting in the habit of supporting heavy objects with both hands, that way not all of the effects of gravity are falling on your fingers in this direction. Another example might be even like chopping a lot with a knife can also like cause those fingers to want to move in that ulnar drift direction. So even swapping out some heavy knife work with like a food chopper or a food processor. And then again, like anytime you have to lift a heavy item, just remember to like use both hands and support underneath rather than holding things like this. And lastly, another tip that I would give you if you're trying to avoid surgery with ulnar drift deformity is to just practice performing range of motion exercises. These can help to, doing certain exercises can help to strengthen your muscles to provide like a counter force to that ulnar drift deformity. So one example of an exercise I like to call radial walking. So if you're gonna picture my hand is, let's pretend it's flat on a table right here. This is the table, my hand's flat on the table. I'm gonna hold it up here to show you. Let's say you're on a table and your fingers are like this with ulnar drift. You would try to walk each finger up. It's hard to do not on a table, but basically you would walk each finger in the direction that you would like it to go to, which is in better alignment, and that is strengthening your hand intrinsic muscles to help to provide a counterbalance or a counter force to that ulnar drift deformity. All right, another question, and this one, I love this one because it actually got me down a rabbit hole of like researching the best recommendation that I could find for this. The best way to floss your teeth if you have hand arthritis other than using a water pick. Okay, when I saw this, I was like, oh, water pick, duh. And then it was like without using a water pick. So I really had to explore some options here. And I ordered this, so I haven't tried it yet, but it's coming in tomorrow and I'll probably create some content about it if I like it. But I found one called the Itty Tooth Bat Wow Adult Flosser. Let me say that again. Itty, I-D-I, Tooth Bat Wow Adult Flosser. This is on Amazon. So this is a reusable flosser, and there's a couple reasons why it stood out to me. It has a wide ergonomic handle. I won't say really wide because I feel like a handle should be this wide to be able to be more ergonomic. But the handle was wider than a lot of other flossers that I saw that are reusable. And the disposable flossers, forget it. Those things are like as skinny, the handle's like as skinny as my pinky, very non-ergonomic. If it's not wide enough of a handle, you can always build it up with foam tubing, or like those giant foam twist ties to make that handle wider. Another reason why I liked it is because the head of it also has 3 sides of floss. So if you're picturing a flosser, usually it has like that skinny handle and then maybe like one little thing that holds the floss like this, but then you have to like turn your arm in awkward directions and you might be using your wrist in weird ways. This one's cool because it not only has that top one, but it also has pieces on the side. So essentially you can just hold your hand in like a more ergonomic position and use all of the different sides to floss. So the jury's still out. I haven't tried this yet, but I'm really excited to try this and I will keep you posted. Will I ever knit again? Yes, there are multiple different ways that you can support your hands while you're knitting or even change your approach. So I guess the first thing I would recommend is looking at your approach, looking at the way that you're knitting. A lot of my clients that are crafty have told me that knitting continental style or even knitting Norwegian style can help. Now, I've never knitted those. I'm like a very basic knitter, but those are 2 techniques that you could look into because I think it involves like a lot less wrist and finger work. You could also look into whole hand and arm knitting. That's really cool because you have to get like a special type of yarn that's really bulky, but essentially like your arm is the needle, and so you're just like using like your whole hand to actually like do the knitting instead of like using your fingers and your wrists. You could also look at different ways of supporting your hands while still keeping your hands mobile enough to knit. So those are things that I already showed you, such as like kinesio tape, the push meta grip, or another similar thumb splint that just kind of immobilizes like that one joint. Compression gloves, or like these elastic thumb supports. Those are all things that you could use to help support your thumbs and your wrists while you knit, but they would still give you some good mobility. All right, any way to prevent pain from working with a laptop and a mouse? Yes, this is actually one of my passions, and I really wanted to include this in Healthy Hands Academy, but it was already getting like so big, and I have so much to say on this. So I'm going to create a separate course on office ergonomics, but I will share like 4 main tips with you. So if you're working from a laptop, you are going to want to look into getting an ergonomic external keyboard. You need an external keyboard regardless of if it's ergonomic or not, because my second recommendation is going to be to raise your laptop to eye level. So if your laptop is at eye level, like if it's propped up on textbooks or if it's up on a laptop stand, that means that your hands would have to be up here to be typing. Like if your laptop is at the eye level where it's supposed to be, so that your shoulders and your neck don't become compromised, that means your hands are up here, and that is not good for your elbows or your wrists or your anything, or your hands. So getting an external laptop once your laptop, or an external, laptop, once your laptop is up here, having that external keyboard down here would then put your eyes and your hands at an optimal position. And I do love an ergonomic keyboard because a traditional keyboard forces our hands to be in this direction, and that can put a lot of strain on our wrists. And so an ergonomic keyboard then forces our hands to come back into more of a neutral alignment. I would also recommend, because your laptop is up here, you don't want to do mouse work up here, so you're going to need to get some sort of external mouse. And so while you're at it, if you're already getting an external mouse, I would recommend you look into a vertical mouse. So this is how a vertical mouse is held. And it just puts your forearm and your wrist in a more neutral position rather than having pressure on your wrist or on your carpal tunnel. And then lastly, even if you have the external keyboard and external mouse, oftentimes if you're doing desk work and those things are on your desk, that can still be too high for your arms. And so you would then need to consider a keyboard tray to have underneath your desk to widen the angle of your elbows to decrease arm strain. All right, thumb joint protection strategies besides splinting. So increasing your thumb stability through exercise is one of the best ways to provide more stability to any joint that's hurting, is by strengthening the muscles around that joint. So in some ways, strong muscles around a joint can almost act like a splint or a hand support. And that way they keep your bone-on-bone joints off one another because they are stronger. So just looking into some thumb stability exercises, here is one I can show you really quick. So oftentimes when we're going to pinch, our thumb collapses. And so just trying to create like a wide circle, like a very round circle, and then trying to hold your thumb out here and then let go. That's an example of a thumb stability exercise that can strengthen these muscles surrounding your CMC joint, which can then provide some relief from CMC joint arthritis. You can also sub a lot of thumb use for larger joints. And so for example, I was with my dad this past weekend, and he was telling me, he was so proud of himself. He was like, "Oh my gosh, I thought about you because I have learned a new way to pull up my pants." So instead of gripping my pants with my thumbs like this, because that can flare up thumb arthritis, he said, I just go like this, and then I pull and raise them up. So essentially we are, instead of gripping with our thumbs, you're slipping your hands in, pulling, and then raising up. And so that's just one example of like so many different ways that you can use your larger joints and muscles of like your whole arm rather than putting the strain on your thumbs. And then again, like another way to protect your joints is those low profile thumb supports like kinesio tape, the elastic thumb supports, the push meta grip, and some other braces that I've already talked about. Okay, what is often misdiagnosed as CMC arthritis? So CMC arthritis occurs right here. X-rays usually confirm this. So some other, I guess, differential diagnoses might include a volar ganglion cyst. That usually occurs like right about here, but that pain right here accompanied by like the lump or the swelling right here might clue someone into, hey, maybe I have CMC joint arthritis, when it's really just a cyst. Also, mommy thumb or de Quervain's tendinovitis, that's like a thumb tendonitis that's common in new moms. That is usually pain right here. So it's close to the CMC joint, but it's more like right in here. And that might involve more of like a shooting or radiating pain down into the forearm. And then there's also arthritis involving the radial styloid, which can often be mistaken for CMC arthritis. So that would just be arthritis that is within your wrist, but not localized to this joint. So some telltale signs or some ways that you might be able to see if you have thumb CMC arthritis without an x-ray is that you have aching and pain in these muscles and near the base of your thumb. That's the CMC joint right there. So pain localized to like that area, especially like common with a lot of gripping and pinching activities. Depending on the progression of your arthritis, there can even be some swelling or a prominence at your CMC joint. I'll show you mine. So you can see that mine is quite prominent right there. But it can progress to be even more prominent than that. And then a positive grind test. So that is when some horrible person takes your thumb right here and actually applies like a downward grinding motion. That can really cause pain. And that's a pretty telltale sign that you have CMC arthritis. Okay, I'm on to the last question. And my answer for this one's pretty comprehensive because I felt like it was a pretty broad and big question. I have osteoarthritis and rheumatoid arthritis in my hands. What is the best treatment for osteoarthritis? I'm on biologic for rheumatoid arthritis. Okay, so this is actually quite common. Often many of my clients that have rheumatoid arthritis are actually told that much of their pain is coming from osteoarthritis. Now here's the way I see it. If your joint hurts from arthritis, it doesn't really matter if it's osteoarthritis or rheumatoid arthritis because we're going to approach it and go at it with the same stuff. Number one, finding your optimal thumb, wrist, hand, and finger supports. And yes, there will probably be multiple, especially if you have both rheumatoid arthritis and osteoarthritis. You're going to find that some supports don't work well for certain activities, such as wearing a bulky thumb splint would not cut it for sewing. So it's about having an arsenal of supports and knowing exactly when to use them and for which activity. And then actually incorporating that into your routine so that you can find some relief. Number two, start with active range of motion exercises for your fingers, thumbs, and wrists and progress from there. So exercise, especially active movements where you don't have resistance against anything. You're just moving your hands, you're moving your fingers, or you're moving your wrists. That is a research-backed way to help relieve pain and prevent pain from arthritis. So again, active movements, meaning like you're just moving in an active motion in a well-controlled way. Usually, you following an exercise program prescribed to you by a therapist. But you just have to know when to progress and if to progress from there. So you don't just jump straight into like the black putty, like the hardest putty that there is. The theraputty is like a resistance thing that you squeeze to increase your hand strength, but you wouldn't just jump there. You would probably start with some active exercises. My third recommendation is to regularly practice those joint protection principles that we've talked about, meaning rather than using the small joints of your fingers and your hands and wrists for those heavy and hard and repetitive tasks, think of ways that you can use your larger muscles and joints. So for example, swap out squeeze bottles in the shower for pump bottles. You see how my hand is flat, my wrist is neutral, and I'm using the motion of my elbow and my shoulder rather than squeezing forcefully with my hand. Another example of this would be, instead of carrying shopping bags using your hand, you would just put them up on your shoulder. That's another way to swap out using the small joints of your hand for your larger body and shoulder joint. This is also where the fun gadgets come in. So for example, like all of the container and jar openers that are on the market, the food choppers, the things that make your keys ergonomic, etc. Number 4, turning to effective pain relief strategies when needed. So knowing your options for effective pain relief and then using them and figuring out which ones work best for you. For example, heat, like we talked about, or ice, compression, creams, TENS, massage. These things can help you to really get over the pain hump or a bad pain flare day, and they might make using exercises a little bit easier on your hands, or it might help your hands to feel better as a way to prep them for exercises. And then lastly, number 5, finding natural ways to decrease inflammation. So arthritis is defined by the CDC as inflammation or swelling in one or more joints. So inflammation or swelling, that is what arthritis is defined as. So there are a lot of holistic ways to decrease your inflammation in your body. For example, consuming foods which support decreased inflammation in your body can help to reduce inflammation from arthritis. All right, this was fun. We'll have to do this again, maybe about a different topic next time. Thank you for joining me. And lastly, like I mentioned earlier, the enrollment for this cohort of students for Healthy Hands Academy ends tomorrow at 11:59 p.m. Eastern Standard Time. I'm not opening it up again for another 3 months so that I can guide the current students that I have through it fully. This is for you if you want to understand exactly which splint and hand support to wear and when, to know how and when to exercise your hands even through a pain flare, how to get back to doing the things that you love with simple yet effective modifications. This is for you if you want to have amazing and proven ways to immediately decrease your pain and inflammation. And finally, you have lifetime access to all course content and feature updates. That is it. Thank you again, and I hope you have a great rest of your evening.